Non-communicable diseases pose a significant health challenge in Sri Lanka, just like in other nations. Conditions such as cardiovascular diseases, cancer, diabetes, and chronic respiratory systems burden individuals, families, communities, and the healthcare system in Sri Lanka. Recognizing the urgency of this issue, Cabinet this week approved the National Policy and Strategic Framework for the Prevention and Control of Chronic NCDs in Sri Lanka. Proposed by the Minister of Health, this policy aims to publish the revised strategic framework and national policy in the Government Gazette and implement in its provisions. According to the World Health Organization, NCDs are collectively responsible for 74% of all deaths worldwide. More than three-quarters of NSC deaths and 86% of the 17 million people who died prematurely or before reaching 70 years of age occur in low and middle-income countries. Heart disease, stroke, cancer, chronic respiratory diseases, and diabetes stand as the leading cause of NCD-related deaths in Sri Lanka, accounting for approximately 120,000 fatalities annually. Contributing factors such as tobacco use, unhealthy alcohol consumption, obesity, high blood pressure, high blood sugar, and high blood cholesterol have been identified as major culprits. Sri Lanka published its first national policy for NCD prevention in 2009. The significance of having national policy to tackle NCDs in Sri Lanka cannot be overstated, and it's commendable that the Cabinet decided to walk the talk without any delay. NCDs stand as a primary cause of death and disability in Sri Lanka, significantly impacting the country's disease burden. By prioritizing prevention, early detection, and the management of NCDs, a national policy empowers the government to alleviate the burden on individuals and the healthcare system. Also, NCDs are not only affect personal health, but also impose a substantial economic toll. These diseases escalate healthcare costs, reduce productivity, and result in income loss for individuals and families. A national policy effectively allocates resources promoting cost-effective interventions that prevent and manage NCDs, thus easing the economic burden. The comprehensive nature of our national policy enables the integration of NCD prevention and management into the existing healthcare system. It fosters a multidisciplinary approach involving healthcare professionals, policymakers, community leaders, and civil society organizations. By fostering collaboration and coordination, the policy enhances the efficiency and effectiveness of healthcare delivery. Implementing a national policy necessitates a robust surveillance and monitoring system to gather and analyze data on disease prevalence, risk factors, and health outcomes. This data-driven approach empowers policymakers to be more informed decisions, evaluate intervention impact, and ensure appropriate resource allocation tailored to the population's specific needs. Therefore, the introduction of a national policy to address non-communicable diseases in Sri Lanka is an imperative step. By reducing the burden of NCDs, promoting prevention and health promotion, allocating resources efficiently, and integrating healthcare delivery, and adopting data-driven decision-making, Sri Lanka can greatly improve the health and well-being of its population. This commendable government initiative is poised to make a tangible difference in the lives of Sri Lankans and create a healthier future for the nation to come.